The government claims that the Health and Social Care Bill will not privatise the NHS. In this video I will show you 3 areas where there will be privatisation in our NHS. But first, I need to dispel one of the myths about privatisation. You will not see for sale signs outside your local NHS hospital. Such an action would be political dynamite. The government knows this. They do not want to be retoxified by privatising our NHS wholesale. So the government will not sell off our NHS hospitals. However, they have found other ways to privatise the NHS. There are, in fact, 3 main areas that they will bring in privatisation. The first area is something called NHS Property Services Limited. Now this is a limited liability company. It has been registered at the Companies House by the Department of Health. It is not a statutory organisation like other NHS organisations. It is a private company owned by the government. The reason why it created this company is because in April 2013 primary care trusts will be abolished. Primary care trusts own a fair amount of NHS properties, including properties like community hospitals and NHS clinics. Some of these properties will be transferred to foundation trusts and other NHS organisations. But about £3 billion worth of properties will not be transferred, and they will be handed over to the NHS Property Services Limited. The government created this company to release resources, which is government speak for selling off NHS properties. So although you will not see for sale signs outside large local acute hospitals, you will see for sale signs appearing outside of community hospitals and NHS clinics. The second way that the NHS will be privatised is a policy called Any Qualified Provider. The Health Bill creates a licensing regime, which means that NHS hospitals and private hospitals will be treated the same. They will both be licensed providers. And any licensed provider will be able to bid for NHS work. And this means that private providers will be able to cherry pick profitable NHS services. These are services which are easy and simple to provide, but the private companies will be able to make profits out of them. When a private provider provides NHS services, this is moving NHS services from the public sector to the private sector, and this is the definition of privatisation. Private hospitals are not accountable. We've seen the effect of this lack of accountability in the PIP scandal. The private clinics who provided the PIP implants were told by the Secretary of State to replace the implants free of charge. Many of these private hospitals refused to do this. They said it was not their responsibility. We will see this happen again and again in the NHS when more private hospitals provide NHS services. Transferring NHS services to private hospitals also threatens NHS hospitals. The reason why it will threaten them is because many services depend on other services. And if you take away some of these services and put them in the private sector, it will mean that the services that depend upon them in the NHS hospital will no longer be viable. And this may mean that some services in NHS hospitals will no longer be provided because the skills simply will not be in that hospital. Further, there is the problem of financial viability. If the surplus generating services are moved to the private sector, where the surpluses become profits, it means that the NHS hospitals where they were transferred from will no longer have those cross subsidies. And that means that some of the services that depended upon the subsidy will no longer be able to provide the services. For example, you may have a hospital in a rural area that provides paediatric services, but there may not be enough children within the area to pay for the salaries of the paediatrician and the specialist nurses. So those clinicians will be subsidised by other services like hips and cataracts. So if the services then are transferred to a private hospital, the surpluses then become profits and will not be available to subsidise the paediatric services, which will then close down to the detriment of the local community. The third way of privatising the NHS will occur through commissioning support organisations. These are not mentioned in the bill, but the bill does allow these organisations to be created. In November 2011, a Department of Health document was leaked to Health Service Journal. This document contradicted all that the government has been saying over the last 18 months, trying to reassure the public over GP commissioning. The document was about commissioning support. Commissioning, on simple terms, is the purchasing of healthcare, but it is more than that. It involves a lot of planning, and it also involves a lot of monitoring. So this is carried out at the moment by primary care trusts. Primary care trusts are statutory organisations. They are part of the civil service. They are covered by freedom of information requests, and they are open. So you can go to PCT board meetings. The government wants to stop this. They want commissioning to be carried out by private companies called commissioning support organisations. As private organisations, they will not be subject to freedom of information requests, and they'll not be accountable. You will not be able to attend their board meetings and question these organisations about the decisions they make and how they came to those decisions. Commissioning involves determining how much healthcare is needed within a community and also who will provide that healthcare. Commissioning also involves monitoring that healthcare to make sure that it remains high quality and to make sure that there is equitable access to those services. The leaked document says that even the largest of clinical commissioning groups will not deliver best value by doing everything in-house. In other words, the Department of Health says that even the largest clinical commissioning groups will not do commissioning. Instead, the document says that clinical commissioning groups will be intelligent consumers of commissioning from these new commissioning support organisations. It is expected that private companies like KPMG, PricewaterhouseCoopers, McKinsey, United Health will become commissioning support organisations. In addition, the existing commissioners within primary care trusts will form commissioning support organisations themselves. And the Department of Health says that these should operate on commercial lines. Further, it says that they will be freestanding no later than 2016. That is, they will be privatised by 2016. The range of work that CSOs will perform is wide. Clinical commissioning groups will delegate all commissioning to these new organisations. So this is the privatisation of NHS commissioning. And it will put private companies in charge of our NHS, because it will be private commissioning support organisations who will be taking the decisions about how much healthcare a community needs, how much healthcare the NHS will pay for, and who will provide that healthcare. There will be no accountability. You will not be able to question the decisions made by these private companies. So there are three ways that our NHS is going to be privatised. First of all, some PCT properties will be sold off. Secondly, some services will be moved to the private sector, putting NHS services at risk. And finally, and most importantly, NHS decision making, the commissioning itself, will be carried out by private companies. So there is only one way that we can prevent this, and that is to drop the Health and Social Care Bill.